Welcome! You are preparing to leave the hospital, or maybe you already have. As the baby's caregiver, you may be instructed to fortify the baby's breast milk. To feed the baby their unique breast milk mixture, it's important that you learn how to prepare it correctly at home. You will follow a recipe provided to you when you leave the hospital. Continue to follow this recipe until the baby's pediatrician tells you to make changes. In this video, we are going to show you how to fortify breast milk. Fortifying breast milk means adding formula powder to plain breast milk. This will give the baby extra calories, vitamins, and minerals to help them grow. You will need the baby's fortification recipe, plain breast milk, the formula powder identified in the recipe, a measuring spoon, a utensil with a straight edge like a spatula or table knife, and a container for mixing. You can mix the breast milk directly in the bottle you will use to feed the baby, or you can make a bigger batch in a larger container to divide into individual bottles later. To start, clean and dry your work area or surface. Make sure the container or baby bottle and the measuring spoon are clean. Always follow the manufacturer's instructions when washing. It is important to check that the breast milk is not expired before you proceed. You may find it helpful to label the containers of breast milk with the date and time it was pumped and with the date and time it was thawed. Then, double check that the formula powder has not expired and the container is in good condition. This means no dents, puffy ends, or rust spots. Most formula powder expires 30 days from when the can was first opened, or on the date stamped on the can, whichever comes first. When you first open the container, write the date on the lid to help you remember. Make sure you're using a measuring spoon that would be used in cooking or baking. Don't use a spoon one might use to eat cereal or ice cream. Now that you have all of your materials, wash your hands with soap and water and dry thoroughly. Review the recipe carefully to understand the correct amounts of breast milk and formula powder. This is called the ratio. For example, the recipe may say fortify with half a teaspoon of formula powder per 3 ounces of breast milk. For that ratio, you'd add 1 teaspoon to 6 ounces of breast milk, or 1.5 teaspoons to 9 ounces of breast milk, and so on. Pour the correct amount of breast milk into your container. Always measure the breast milk first before adding the formula powder. Measure the correct amount of formula powder using the measuring spoon. This is important. Do not pack the powder into the measuring spoon unless your recipe tells you to. Use the spatula or table knife to level out the powder in the measuring spoon. Add the powder to the breast milk in the mixing container. Seal the mixing container and gently swirl the breast milk to dissolve the powder. If you're mixing in a bottle, use clean hands and a tissue or paper towel to pinch the nipple closed. Do not shake the breast milk mixture. This will break down important proteins in the milk. If you're not feeding the baby right away, mark the date and time that the breast milk was mixed on the container. You could use a Post-it note or masking tape. Place the container in the refrigerator. Please remember that once the breast milk has been mixed with the formula powder, you must feed it to the baby within 24 hours. Any leftover breast milk mixture in the refrigerator that is more than 24 hours old must be discarded. Reminder, gently swirl the bottle after taking it out of the refrigerator before feeding. To warm a cold bottle of breast milk, place the bottle in warm water for several minutes. Never microwave breast milk. Microwaves heat liquids unevenly and can burn the baby. Always check the temperature of the warmed breast milk on the inside of your forearm before feeding the baby. After you feed the warmed bottle to the baby, the breast milk in that bottle is safe for 1 hour from the time the baby starts drinking. After 1 hour, any breast milk left in that individual bottle must be discarded. Once baby has eaten from the bottle, do not return the bottle to the refrigerator to save for later. This could lead to the growth of bacteria. Always thoroughly wash and sanitize everything before using again. This includes the bottle, nipple parts, and the mixing container. Once home, if you have any questions, ask the baby's pediatrician.